we talked a lot about very specific issues that wind up affecting the precision and the repeatability of these kinds of analysis that are going to change clinical management for individuals within the screening process. Now, our filters are just on screening application, because you could turn around and use coronary calcium in a much different population, and actually it would potentially greatly change the parameters that you might want to optimize towards. So we're staying within this comprehensive screening because the people eligible for lung cancer screening who have heavy tobacco exposures represent a subgroup that enjoys, unfortunately, about 44% of the total burden of premature death on our planet. The next 20 other causes of death do not equal the aggregate impact of those three diseases. This is a big problem. And if we focus just here, just heard how complicated it's going to be. But if we don't have any kind of focus, we just are going to be boiling the ocean. And so we're going to stay here. And I'd like to say that from the perspective of our earlier presentations, an image from an individual in a screening setting is a biospecimen. It's a digital or virtual biospecimen. And to the extent that we do our job and acquire it with optimized, fundamental, physics-based criteria, we have a neutral biospecimen that allows us to look at change through time, through technology, through evolution of diseases and stuff like that. And I would posit that the CT image from a public health perspective is the most valuable biospecimen that you can acquire, because it can look at multiple diseases in a setting where it leads to more premature death than anything else we will interact with. So getting this right is incredibly important. So are we just kind of hand-wringing? The next question I wanted our experts to very quickly address in our waning minutes is AI is coming along. How will AI interact how you start looking after the biospecimen, the image, to ensure that you can do all the various types of characterizations that we're talking about in this forum? Rick, you want to start? Just very brief.
AI has multiple possible ways it can be introduced. So there's deep learning reconstruction, right? There's also AI algorithms for measurement, right? Which were you mostly focused on?
Well, they're all going to interact, right?
Yep. Yep.
So you pick.
Well, I'll just start with the deep learning reconstruction. There's potential there for great improvement, as we all know, but there's also potential there for modifications to the image, which let's say counter our goal of getting an accurate measurement. And what we have to do is we're adapting our phantoms right now to be able to detect when let's say a reconstruction is performed and it appears as though it has a high resolution, but in fact, it really doesn't. And unfortunately, it might get that high resolution on certain types of objects, but not on other types of geometries. So it's a constant battle to develop new, efficient, low-cost, highly accurate calibration devices that let us stay on top of what's happening in the reconstruction space.
Thank you. Sean?
Yeah, something we haven't talked about yet is using AI tools or even models to correct images. So if you're imaging longitudinally, for example, in my application, looking at lung density, lung volume correction isn't a correction that we often apply using basic models, sometimes just to maintain constant density through a sponge model of looking at lung volume through time. But I think AI could play a role in that. And in addition to that, denoising or mimicking the conditions that a filtered back projection reconstruction would generate versus an iterative one in order to bring two images acquired on different systems, maybe over time in alignment for measurement. So I believe AI could play a role in that space.
Thank you. Ardit?
I think AI may be more affected by a lot of these differences and in the scanner acquisition protocols and the reconstruction protocols than humans are. And so I think it's something that the industry is going to have to address at some point. But I think Sean had brought up something that was interesting, and that is, and I hadn't thought about this, but you could in theory use AI to help correct the AI results in a sense. And that I think is going to be an interesting aspect moving forward.
Rosemary?
Assuming calibration of AI systems, I think that's the only way in which we can integrate all kinds of additional evaluations in the CT screening, because we just don't have enough radiologists to look at it visually. So they can maybe supervise, but preferentially it should be automated. So that's point one. And point two I want to make is that we have evidence for lung cancer screening. And we have all kinds of, let's say, signals on a CT scan, but that's not the same as actionable information. And so, I mean, let's look at liver density. What do we exactly do? What advice do we give at a specific density? That's something we still have to sort out. And we need to know that for sure. Otherwise, everybody gets completely confused and the healthcare overrun.
Yes, yes. So interoperability and transparency, critical features. Mathis?
Oh, well, I can give a comment from the German perspective, because we're just starting with lung cancer screening, and I think at some point that's a good thing, because we have this very short new legal document, this ordinance that says how lung cancer screening should be done from a legal perspective, and it has this requirement that the screening needs to include computer-assisted detection. And the software needs to do the volume detection, so the nodule detection, the calculation of the volume, and the volume doubling time if someone is screened 2 times, and also a structured report. But it does not say that it cannot do other things as well. And it also does not say that it cannot be AI that is doing whatever is assisting. So we might have a leverage there of including things that are not officially mentioned in the document, but we could do it.
Thank you very much. I think we're out of time. We have other forums in which we'll continue these discussions, but I want to thank all the presenters, discussants for some wonderful insights.